Hello and welcome to the first video of my series of audio medical basics to listen to as you drive, as you wait for an exam. If you're confused, please watch the introductory video where I said that I'm making these videos as an audio video, something to listen to and refresh your medical memory as you drive for an exam or wait for the college. Now, just sit back and relax as I read to you the anatomy and some of the physiology of the ear, nose, and throat from this nice book from ICT, Ear, Nose, and Throat, and Head and Neck Surgery. An illustrated color text. Well, I'll be the one seeing the illustrated text. You concentrate on the road and drive. Okay, so first, anatomy and physiology of the ear. So the ear has three parts: the external ear, the middle ear, and the inner ear. So the external ear includes the pinna, external auditory meatus, and tympanic membrane. The outer part has a cartilage skeleton, and the deep part is bony. So both are covered by skin. The skin on the outer part contains hair follicles and wax. So the outer part has a cartilage skeleton. The deep part is a bony part, and both covered by skin. The skin on the outer part contains hair follicles and wax glands, but these elements are absent in the deep meatus. Canal skin migrates outwards from the deep meatus but does not desquamate until it reaches the junction with the cartilaginous meatus. This normal mechanism may be disturbed by injudicious use of cotton buds, so beware of cotton buds. Okay? So, external ear, pinna, external auditory meatus, and tympanic membrane. Outer part of the external ear has a cartilaginous skeleton. The deep part is bony. Okay? All covered by skin. And the outer part contains the hair follicles and wax, and these are absent in the deep meatus. The eardrum is the window of the middle ear and is divided into the pars tensa and the pars flaccida. So eardrum is pars tensa and pars flaccida. The main landmark on the drum is the malleus handle. And there is an image here. So if you've been asked what is the main hallmark on the drum, it is the malleus handle. The malleus is one of the small bones of the ear. Yeah. So that was the external ear. The middle ear is an air-containing space connected to the nasopharynx via the eustachian tube. It acts as an impedance matching device to transfer sound energy efficiently from air to a fluid medium in the cochlea. The cochlea. I'll call it cochlea, okay? You call it whatever you want. It's a cochlea. The middle ear space, including the mastoid air cells, is closely related to the temporal lobe, cerebellum, jugular bulb, and labyrinth of the inner ear. Not important, the space contains three ossicles, the malleus, incus, and stapes. So these are the three little bones of the ear. Three bones, the malleus, incus, and stapes, which transmit sounds, vibrations from the eardrum to the cochlea. The middle ear also contains two small muscles and is traversed by the facial nerve before it exits the skull. Okay, so that's the middle ear. Important about the middle ear, it's an air-containing space, connects the nasopharynx via the eustachian tube, acts as an impedance matching device to transfer sound energy efficiently from air to a fluid medium into the cochlea. Okay. The third part is the inner ear. The inner ear comprises a dense bony capsule containing a membranous labyrinth which forms the cochlea, vestibule, and semicircular canals. The membranous part is surrounded by a fluid called perilymph and is sealed from the middle ear by the stapes footplate and round window membrane. The membranous part itself contains fluid called endolymph. The cochlea contains the organ of hearing, which is connected by the auditory nerve to the brainstem. We have a cut section here through the cochlea, where the hair cells in the organ of corti transform mechanical energy, vibration, into electrical impulses. I had an arrow, I had to say that earlier, but never mind. Normal hearing depends on transmission of sound via vibrating tympanic membrane through a mobile ossicular chain to the cochlea. Displacement of the basilar membrane and movement of the hair cells cause an organized volley of electrical discharge in the eighth nerve, perceived as sounds in the cerebral cortex. The vestibule and semicircular canals form the peripheral balance organ. These have connections to the cerebellum and eyes and are important in the maintenance of posture and ability to keep the eyes fixed when the head is moving. So I owe you that, so I'll repeat this part for you. The inner ear comprises a dense bony capsule containing a membranous labyrinth which forms the cochlea, vestibule, and semicircular canal. The membranous part is surrounded by fluid. The fluid that surrounds the membranous part is called perilymph and is sealed from the middle ear by the stapes footplates and round window membrane. The membrane part itself contains fluid. So around it is the perilymph. Inside the membranous part, is the endolymph. The cochlea contains the organ of hearing, which is connected by the auditory nerve to the brain stem. So, normal hearing, a little physiology here. Normal hearing depends on transmission of sound via a vibrating tympanic membrane through a mobile ossicular chain to the cochlea. Displacement of the basilar membrane and movement of the air cells cause an organized volley of electrical discharge in the eighth nerve, perceived as sound, the cerebral cortex. This is about the ear anatomy and brief physiology. Now we quickly move to the anatomy and physiology of the nose. Okay. So the nose is divided into the external nose, the nasal cavity, and the nasal septum. Okay, the external nose. The upper third of the external nose is bony. The upper third, it's bony. It's consisting of nasal bones which connect with the nasion at the forehead. This thing is a nasion of the forehead. The inferior two-thirds are cartilaginous, consisting of the upper lateral and lower lateral alar cartilages. Okay, so upper third is bony, the inferior two-thirds are cartilaginous, consisting of the upper lateral and lower lateral alar cartilages. The tip laterally contains resilient but pliable fibrocartilage. This allows maintenance of nasal shape after minor trauma. Boing! The skin over the cartilaginous portion is closely adherent and contains multiple sebaceous glands. These latter structures may hypertrophy to form a rhinophyma. So that was the external nose, upper third bony, lower two-thirds cartilaginous. Skin over the cartilaginous portion is closely adherent and contains multiple sebaceous glands. So then comes the nasal cavity. The nasal cavity stretches from the vestibule anteriorly to the nasopharynx posteriorly and is divided by midline osteocartilaginous septum. The lateral wall of the cavity supports a series of ridges called turbinates. These structures are lined by ciliated columnar epithelium and contains erectile tissue. The paranasal sinuses, which are the maxillary, frontal, ethmoid, and sphenoid, drain into the nasal cavity around the middle turbinate. Okay, so the nasal cavity stretches from the vestibule anteriorly to the nasopharynx posteriorly. It is divided by a midline osteocartilaginous septum. The lateral wall of the cavity supports a series of ridges called turbinates. These structures are lined by ciliated columnar epithelium. So the turbinates are lined by ciliated columnar epithelium and contain erectile tissue. The paranasal sinuses, maxillary, which are the maxillary, frontal, ethmoid, and sphenoid, drain into the nasal cavity around the middle turbinate. And finally, the nasal septum. The nasal septum comprises bony and cartilaginous elements. Inferiorly, it is inserted into a groove in the maxillary crest. It is lined with mucoperichondrium and mucoperiosteum over the cartilage and bone. Respectively, the nasal septum is rarely straight. Marked displacement causes nasal airway blockage and external cosmetic deformity. Okay, so we spoke of the external nose, the nasal cavity, and the nasal septum again comprises of bony and cartilaginous elements. Inferiorly, the nasal septum, inferiorly, it is inserted into a groove in the maxillary crest. It is lined with mucoperichondrium and mucoperiosteum over the cartilages and bone, respectively. Okay, this comprises the end of, well, part 1 of this anatomy and physiology of the ear, nose, throat, and I think I will continue in the part 2. Thank you very much and stay tuned for part 2 of this journey.